Thank you. Appreciate Doctors Data being willing to sponsor this and dive into this deep topic. And it's always a great topic to explore. I'll do my best to give you some new information. We only have 45 minutes to an hour. We could, in my nutritional pathology course, I spend an entire weekend on the gut and microbiome. So, 12 to 15 hours where we go pretty deep. But today my goal is to really give you some new information, maybe some information that you haven't thought about, just some of the updates that we have with the microbiome and with gut health. So it's going to be a great 45 minutes to an hour. We've already had some great questions that we'll address at the end. So like I said, there's a lot of different areas that we can go into when we're talking about the gut and the microbiome and the gut host health. So I want to narrow it down to today so that the attendees can understand how specifically gastrointestinal health affects metabolic, circadian rhythm, our immune, brain, and specifically, and most importantly, the mitochondria. This gut mitochondria axis, if you will, is emerging as one of the most important and overarching. So we all are familiar with the gut brain, and we're familiar with the gut immune and how it affects our endocrine system. So, but what we're seeing is that the mitochondria actually might be where all of that gets tied in. It's how all of our systems, our lungs and brain, immune system, it's actually the mitochondria that might be driving all of these changes due to the microbiome and our gut health. So we'll explore some of those mechanisms. We'll talk about the causes and consequences of dysbiosis, and least but not less important is treatments and protocols that I have for gut health. So everybody has treatments and protocols. It's so important to know and to understand that we have to think critically when it comes to gut health. Protocols can be a good starting point, but everybody's microbiome is vastly different. Even our own microbiome is different from day to day. And so to expect a protocol to fit everyone is naive at best and harmful at worst. So, but protocols can be helpful in terms of what to start with and, where to go from that. So, and there are some basics and some principles that we want to understand about how to use probiotics, when it's appropriate, when it's not, what type, what we have to do to help probiotics work and actually colonize. So a lot of good information that we'll go over today. So if the GI system is unable to digest, absorb, and assimilate nutrients while providing a barrier system to selectively prohibit invasion of unwanted microorganisms and maintain a healthy balance of commensal microorganisms or autochthonous microorganisms, health will forever be out of reach and disease the prevailing norm of society. And, we can't ever underestimate the importance of gut health in our entire whole system. The host health of all of our systems. So, and it really, we'll talk about it why do we have so much dysbiosis? Why do we have so many gut problems? Why is intestinal permeability such an issue? And why is the emerging research so clear that leaky gut and dysbiosis precedes just about every disease that we study? Now, once we now know, it's called translational research. Once we understand this concept and we have the mechanisms, we start to apply it to different pathophysiology of different diseases. So we see that more and more. This is one of my favorite. It's actually an electron micrograph, colored obviously, but this is an actual picture of bacteria eating a fiber of a vegetable. And this is important because one of the most important determinants, most powerful and significant determinants of our microbiota is diet. And what we eat is the single greatest factor in in our microbiome and microbiota. The difference between microbiota and microbiome, by the way, the microbiota is actually the different phylum and classes and the different microorganisms. The microbiome is referring to the entire genome of the different microbiota. So I've often said this, that the greatest gift that parents give to their child, or their greatest detriment that they give to their child, is actually through the microbiome. And we'll talk about one of the passions in my practice and in my course is preconception planning and postnatal support. And the whole pediatric gut is so important. We now know that the uterus, most people, the first exposure to microorganisms is in utero. And things like taking antibiotics during pregnancy has significant lifelong impacts on the child's gut and microbiome and consequent susceptibility to different diseases. So really important there. And there are, we have over 500 to 1,000 species, give or take. It's a big number, but 500 to 1,000 species, different species of bacteria in the gut, and then almost an infinite number of subphyla within that, because bacteria change genetically within your gut day to day. And so there are bacteria that exist in your gut that don't exist anywhere in the world. And so these are our family heirlooms that have been passed down that are related to, the geographical area and our genetics and many different things. So that's, having a healthy gut microbiome is one of the most important things you can do. And that's actually why we see so many studies that correlate vaginal birth with healthier microbiomes. But that is assuming that person has, that mother has a healthy vaginal and whole body microbiome. So it's actually not helpful if that mother is taking antibiotics close to delivery, for instance, for strep B infections or something, or to bladder infections, which is so common. In that case, there's actually some evidence that C-section might be better, so that the child doesn't get exposed to some of the imbalanced flora. That's down the road. I mean, maybe one day we could actually run studies and mothers and see what their bacterial vaginal flora is like, and then determine what might be best for the baby. But truly, if the mom has a lot of dysbiosis and the baby's born vaginally, some studies have shown that increases cytokines in the baby, negatively. We don't know, how long that might last specifically, but we do know that increased cytokines, specifically perinatally, is a huge epigenetic factor. It's changing the genes. It's changing how the baby is going to develop, especially in the brain and nervous system. GI problems are obviously on the rise. These are like major GI problems. I think the most important thing to take away from this is not only is our gut getting more severely pathological, but the consequences of even functional gut problems like leaky gut or intestinal permeability are almost ubiquitous. And most people don't have gut symptoms when they have functional gut problems like leaky gut. So a lot of people with leaky gut just don't have any gut related symptoms. And that's a big paradigm shift for clinicians, because we tend to only treat symptoms. One of the greatest things you can do for your patients is to understand how the gut affects different systems, our biological systems, so that we can start thinking when it's appropriate to run GI tests and to understand the importance. So any, endocrine problems and, so hormonal imbalances, certainly brain is common, lung, immune, almost every, disease, certainly autoimmune. These are the things that we have to understand that have an important gut connection, and check for intestinal permeability and dysbiosis. So Celiac disease is almost doubled, and it's doubling every 10 years. So, and we see there's many correlations between antibiotic use and the subsequent development of leaky gut. So that's just one factor. But again, I think it's a lot of genetic factor, or a lot of these preconception factors and the epigenetic factors. Babies are born every generation with less and less healthy guts. So this is a good study here that kind of summarizes. Let's go back here. So let's take the definition of leaky gut here, or of dysbiosis. And it's essentially a change in the composition, both commensal and pathogenic. We know that this imbalance has severe effects, not just in the gut, but extraintestinally as well. Rapid changes in feeding habits, rapid changes in our gut health, obviously increased pharmaceutical use. All of these are part of the dysbiosis. And that's why I like the doctor's data test to give, it's one of the best tests to give you an overall look at the dysbiosis. PCR technology has come a long way, and it continues to evolve. And I believe that doctor's data, I've done tests from pretty much every other company. I know that doctor's data tends to stay up on the most current and the most reliable technology with PCR, because it changes rapidly and it's improving rapidly if you know what you're looking at. So, and time of day, that's why I like doing the 3, within each day, there's a lot of intraday variability in our microbiota. So doing a 3 collection is I think gold standard, and something that's worth doing. And that's long been known, but yeah, do a 3 collection. It's worth it. So let's talk about, well, here's a couple, like I mentioned, infants born by C-section. It's still controversial, because again, if you tease out, if the mother has healthy vaginal bacteria, then it's more beneficial. If they don't, then it's less beneficial. But if we start, if a few studies have started to look at that, rather than just overall comparing C-section to vaginal. So one of the most important aspects of gut health is to understand the gut-brain axis is a two-way street. The gut absolutely affects brain health, but the brain and stress is probably, other than diet, the next greatest indicator and influencer on our microbiome. So we have this huge enteric nervous system. There's ways to improve digestion, and it all centers around the vagal nerve and vagal nerve stimulation. Eating slowly and chewing your food, many studies have actually shown that is one of the most beneficial ways of improving your microbiome. It also stimulates more digestive juices. There was a question about the pH balance in the gut and how that influences the microbiome. And ultimately, the pH in the gut is determined by our hydrochloric acid concentration and our pancreatic function. So when we look at elastase, and I'll get to it down in later slides, but when we look at elastase, that's one of the best markers for pancreatic function. So ways to improve our hydrochloric acid and ways to improve our chymotrypsin and trypsin and support a healthy pH is to eat slowly and chew our food. Obviously doing breathing and the polyvagal theory is very good. There's lots of ways to stimulate vagal nerve function. Eating an anti-inflammatory diet, taking enzymes with meals if needed. Walking after eating is incredibly helpful. It's one of the best ways to stimulate digestion and change bacterial composition. Exercise is something that is not talked about enough in the research. There's a lot of research on it, but exercise significantly positively influences our microbiome. And to a point, because if you over-exercise, and they did research for the military and for athletes, endurance athletes, if you exercise intensely, that can actually tip you over into leaky gut, because what you're doing is you're taking the blood flow from the gut and into the periphery. And if the gut goes too long without the blood flow, then it starts to induce leaky gut and microbiota changes that are unwanted. However, it is the hypo and hyperperfusion that exercise induces that stimulates the repair of the gut. Also, when you're using more calories, that stimulates chemical messengers and interleukins to stimulate repair of the gut. So you can't have a healthy gut. When I teach the three-legged stool of treatment, right? So it's an overused, simplified analogy, but it gets the point across that if you don't have all three legs of a treatment plan, your treatment plan is going to fail. And the essential treatment plan that I teach doctors to always make sure they have is diet, lifestyle, and supplementation. And you can't make up for a missing leg with two strong legs. So diet, obviously, an anti-inflammatory diet. I can spend an entire hour or two talking about what specific diets do to the microbiome, what ketogenic diets do, what paleo diets do. They all have, ketogenic diet has a beneficial effect on the microbiome, but only for about a month or two, and then it starts to have a detrimental effect. It also tends to have, same with paleo diets, same with strict paleo diets. Ultimately, we want the best influencer of the microbiome long term is kind of this anti-inflammatory paleo Mediterranean whole foods diet, obviously organic. Glyphosate has a negative impact on the microbiome. Plastics have a negative impact on the microbiome. Everything we ingest is influencing our microbiome. That's the one takeaway you can count on. And I've got some really good studies in my lecture. And it's actually, if you go to my website, I'll get to it at the end of this lecture. But if you go to my website, Dr. Brandon Lundell, and go over to courses, Module 3 is my deep dive into the GI system. And I've got some really good studies showing how BPA and BPS, how they change the microbiome as well, significantly. So just having a little bit of plastic in the diet, but certainly the herbicides, pesticides. There's a cutoff between a healthy diet in terms of how much organic you should eat, and it seems to be about 75%. If 75 to 80% of your diet is organic, then that's sufficient to support a good, healthy microbiome. Lots of other factors too, how much chlorine is in the water. So drinking purified water is also really important. And water itself is emerging as an important prebiotic, if you will. But a lot of people are dehydrated, and that has a significantly negative impact as well on the microbiome. So food sensitivities, doing your IgG, IgA food testing can be helpful in removing those foods, and not overeating. Overeating, I think, can be a big cause of SIBO. And SIBO, again, is another deep dive. Essentially, when you're looking at SIBO, the most important factor is looking at the stress, what stress does to our digestive enzymes, what it does to our hydrochloric acid, what it does to our ghrelin, what it does to somatomedin. And if you look at the phenotype of people with SIBO, they're almost always a stress, type, more anxiety type of people. So I don't know if you've noticed that in your practices, but I certainly have. And so working with that and working with their enzymes is probably the most important factor. You can use bacteriophages, which are viruses that attack certain bacteria. I have a SIBO protocol that you can implement as well. I am going to go over some of the protocols But what I want people to know is that if you want to know exactly which products that I use and my specific protocols that I use, you can email me. I'll give you my email at the end of this lecture, and I'll tell you after 15, 16, this is my 17th year of practice, I've developed protocols that do work that you can adjust to each patient, but a good basis to work from that I found works well. This study, central nervous system control of GI motility and secretion of and modulation of gastrointestinal functions. Again, it's the vagal stimulation. It can cause vasoconstriction. It can cause decrease in hydrochloric acid and leaky gut. What I would say, this is a good study. Peripheral apelin mediates stress-induced alterations. Apelin is a new hormone that is a stress mediator. But if you any kind of stress increases apelin, and so there's things that we can do to tone down apelin, specifically anti-inflammatories. One of my favorite is actually for the gut, interestingly enough, is St. John's wort. It's actually very good for gut health and for decreasing apelin. Also quercetin, resveratrol, those, curcumin, those anti-inflammatories can help mitigate some of the effects of stress. In this study here, again, just looking at the microbiota and autonomic nervous system balance. And when the autonomic nervous system gets imbalanced, the microflora gets imbalanced as well. And we'll talk about how that happens. This is why it's actually really important. I almost always run a neurobiogenic amines test, so a neurotransmitter test, with a GI test. Why is that? Because mostly what you're testing for in the neurobiogenic amines test by doctor's data is what your enteric nervous system is doing, which is greatly influencing the central nervous system. So I like to see, where the GABA, where the serotonin, where those things are at. So, look, and we'll talk about tryptophan and using that and cautions with that here in a minute. So microbial encroachment here, when we lose the brush border, and what I'll say about this is a really important point is I do not use probiotics unless I know that there's an intact brush border. The studies are very clear that if you don't have an intact brush border, you can actually do more harm than good with probiotics. So making sure that somebody is on a leaky gut protocol for a while, 6 weeks, 4 to 6 weeks before using probiotics in general is helpful. There are specific times where you want to use probiotics, perhaps around a time when someone's taking antibiotics or they have severe infections, obviously. But in general, you can't colonize no matter what probiotic you're using without a good brush border and intact barrier system. So my leaky gut protocols include things like N-acetylcysteine, butyric butyrate, obviously glutamine and things that everyone knows about, but also mushroom extracts have been emerging as extremely important leaky gut and intestinal permeability repair nutraceuticals. So there's some really exciting stuff around that. Arginine, you can use some of that as well. So losing, and this is again an important point about, so let's take the Firmicutes bacteroides controversy where, if you have high Firmicutes and low bacteroides, that's a sign of obesity, or that can portend obesity or metabolic changes. One of the interesting things about that is that's only applicable if you have lost your brush border, if you have leaky gut. If you don't have leaky gut, then that ratio is not really that helpful. And one of the interesting things, one of the reasons we know that is because actually bacteroides, the class, actually secretes more lipopolysaccharides and contains more gram-negative bacteria. So having a higher bacteroides, you would think would be actually a negative detrimental effect because you're secreting more lipopolysaccharides. But again, that's only applicable if you have an leaky gut, because then those lipopolysaccharides can cross into the bloodstream and into general circulation. Again, vagus nerve is the modulator of the gut-brain axis. Deep breathing and meditation and exercise, singing, things that you can do to balance the vagus nerve. Remember here that 90% of the vagus nerve is afferent. So it's actually information from the gut going into the brain. So if the vagus nerve isn't working properly, then you can't get proper hunger signals, proper, ghrelin and somatomedin doesn't get to the brain. Leptin signaling doesn't get to the brain. So it's that afferent fibers that we want to stimulate. And this is where probiotics can help stimulate that. Exercise can help stimulate that. Even gut massage. There was a technique that I've learned, early on in my career of just gently massaging the gut. That's been shown to have a great benefit. We forget the power of our hands in healing, and just doing gentle massage or getting gentle massage on our gut has a very positive impact on our microbiome. So this study here, the effects of stress and meditation on the immune system, human microbiota and epigenetics. So decreasing corticotropin releasing hormone and catecholamines. Catecholamine production is one of the most detrimental effects. I've seen some studies that show that the catecholamines, adrenaline, that induces leaky gut almost instantaneously. Now, it's short-lived, but if you keep secreting epinephrine and norepinephrine, then you're just promoting leaky gut throughout the day, and that's just one more risk factor. Stress increases cortisol, which damages the hippocampus, increases interleukins. This IGF-1 is a point of research. A lot of researchers are showing IGF-1 gets stimulated during dysbiosis. And so, just measuring IGF-1 can actually be a very good indicator of dysbiosis and other cytokines as well. And then increased quinolic and kynurenine is really important too. So these cytokines, the effect of dysbiosis on cytokines, which cross the blood-brain barrier, is extremely important to understand. But it's these cytokines that, not just lipopolysaccharides, but it's the cytokines that are the mediators of the gut-brain axis. So LabCorp has a great cytokine test that you can use. You can actually measure cytokines, all the different interleukins, and that's another indicator of leaky gut or dysbiosis as well. But there's some good research recently coming out of COVID that having intestinal permeability is a huge risk factor in cytokine storms. And it makes sense. It's not a big stretch for those of us who understand this. We could predict that. We know leaky gut precedes autoimmune disease. You have to have leaky gut to develop autoimmune disease. So all of these things are not a surprise, and the research is kind of confirming that. So the cytokines through the leaky gut, through the intestinal permeability, through dysbiosis, is called the inflammatory hypothesis of neurodegeneration and depression and neuroplasticity. Many studies showing leaky gut induces schizophrenic episodes and is related to Alzheimer's and Parkinson's. So this is not anything new. I think the research is so clear on this. But I'll get to in a second why these cytokines also, how this works, how this pathophysiology works. We know it affects MAO, and we know it affects neurotransmitter production and metabolism, and that's a huge risk factor. It affects the myelin sheath and through toll-like receptors. but how it affects the mitochondria is something that's been overlooked and really important. So I'll just go through quick about the kynurenine system and tryptophan metabolism disorders. Tryptophan is metabolized through several pathways in the gut. And so, you can run a quinolic or kynurenine. And if those are high, then that tells you that's another marker of dysbiosis. Never supplement tryptophan if a person has dysbiosis, because what you're going to do is increase quinolic acid and kynurenate, and you're going to make that neurodegeneration potentially worse. Almost every, specifically autism, but almost every neurodegenerative disorder that we link the gut to has this tryptophan metabolism issue, and it's caused by dysbiosis. It's caused by the bacterial endotoxins effect on the enzymes within our gut. So leaky gut, dysbiosis, and infection in the gut, stress, inflammation, and decreased glutathione, how it affects our redox capability. This is why N-acetylcysteine is absolutely imperative in any leaky gut or health gut health protocol, because it does several things. One, it breaks down biofilms. So your dysbiosis protocols, your antimicrobials or antibiotics will work better with N-acetylcysteine. But one of the first things that happens in dysbiosis and in leaky gut is the loss of glutathione within the enteric cells. That is proven. That is not really disputable at this point. So I think people forget, I think a lot of clinicians forget that point, that, and this is why some of the early research about taking glutathione orally didn't really get systemically. And that's because the enteric cells were taking up the glutathione to repair, and that can take several months. So taking glutathione orally is actually very helpful. But N-acetylcysteine is what stimulates the enteric cells to produce their own glutathione. And we have a transporter on top of our enteric cells called the excitatory amino acid transporters type 3 or EATT3. That transporter is what allows cysteine into the cell for the cell to make glutathione. And you cannot repair leaky gut without that, without enough cysteine and without enough redox potential in the gut. So, and interestingly enough, gluten and casein and reactive oxygen species, heavy metals, glyphosate, BPA, all of those things specifically inhibit that excitatory amino acid transporter. And so, you need to remove those at the same time you're doing N-acetylcysteine. N-acetylcysteine will also chelate heavy metals and glyphosate and herbicides and pesticides within the gut. So I usually do 2,000 to 3,000 milligrams a day for leaky gut protocols. But if you see high kynurenate and high quinolic acid, and you see low serotonin and high 5-HIAA, that's almost pathognomonic for dysbiosis and leaky gut, in my opinion, and in some of the research as well. So that's what you have to treat in order, and usually in the case of autism and things, there's an infection that's driving that. So C. diff, or even if it's just dysbiosis. Oral contraceptives have a huge impact on the microbiome as well. Usually negatively, usually causes a lot of gram-negative bacteria. It also can induce leaky gut. So oral contraceptives are something that you want to look at as well. So again, increased glutathione status within the gut, increased methylation, calorie restriction, exercise, lower the BMI, melatonin and 5-HTP supplementation would be better during a tryptophan metabolism disorder rather than tryptophan itself. So melatonin supplementation is also very important in leaky gut and dysbiosis. Usually what I do is 1 to 3 milligrams. You usually don't need more than that unless you're dealing with H. pylori. Lots of good studies that show melatonin, 7 grams, 5 to 10 milligrams, of melatonin for 7 to 14 days with 5-HTP or tryptophan actually heals leaky gut better than double antibiotic therapy and proton pump inhibitors, which is still kind of the sad gold standard for ulcer treatments. So again, never supplement with tryptophan or 5-HTP unless you balance this pathway. Interesting study here because hormones are something that I work with a lot in my practice. The inhibitory effect of DHEA on brain monoamine oxidase activity. So when you look at your neurobiogenic amines and you see high MAO activity, and we can see that through a high 5-HIAA or a high DOPAC reading number, then that is what tells you that you have high or suggests that you have high MAO activity. Plus, look at the patient's phenotype. Look at are they experiencing anxiety and depression and sleeplessness and things. So running your hormone test, seeing what their levels of DHEA are. If they're low, absolutely imperative that you put them on a little DHEA. But even if their DHEA is normal, you can use DHEA short term because it's an antidepressant and it's neuroprotective. And it also helps with infections. It slows viral replication. I did a webinar with Doctors Data, was that in June, a couple months ago, and that's on their website. And it's also on my YouTube channel as well. But it talks about how taking DHEA when you get an infection, or if you're going to get the vaccine, for instance, actually increases antibody responses. So that's something that is important. This is a great study too. The effect of DHEA on the immune response and gut microbiota in colitis, in leaky gut. So when they induced leaky gut, DHEA inhibited the formation of leaky gut in those mice that got DHEA while they got the dextran sulfate induced colitis. So very interesting what DHEA can do, and also tells you how detrimental having low DHEA is. This goes back to the gut adrenal axis or the adrenal gut axis. When you have low adrenal function, low DHEA, or high adrenal function, that has a direct significant negative impact on the gut function. So now let's talk about the mitochondria. This is a really good study that came out a few months ago, tying in mitochondria as really the integrative hub that's affecting the circadian rhythm, metabolism, microbiome, and immunity. And this is kind of looking at what the interleukins from the gut are doing, what the butyric acid, what the short chain fatty acids are doing in the mitochondria, just how it affects epigenetics, how it affects acetylation of the histones, the synthesis of the prostaglandins, dendritic cell migration. So the lipogenic factors and what it does to our metabolism. So propionate, acetate, butyrate. If they're too low, then you're going to get a negative impact on the mitochondria, and you're not able to process glucose very well. If they're too high, specifically propionate and acetate, which you'll get sometimes during SIBO, then you're going to shut down fat metabolism in the peroxisomes in mitochondria. So when mitochondria are exposed to lipopolysaccharides, as well as these other short-chain fatty acids, it almost immediately induces decoupling and micropore activation in the mitochondria, and it leads to the mitochondrial DNA demethylation and dysregulation. So you are directly affecting mitochondrial DNA through dysbiosis and through these pro-inflammatory cytokines. The metabolome is all the totality of all of our metabolic signals and inflammatory signals and how they affect the functioning of the mitochondria and functioning of energy production. This is it's a really good study. I encourage people to download it and read it. One of the most important detrimental factors is its effect on NAD and NADH. And we see that affecting NAD can improve function. I mean, a lot of practitioners, including myself, can do NAD IVs, and that can be helpful short term. But again, always treat the cause. You never just want to have a patient depend on IVs for their health. Why is NAD low? And we see that NAD and NADH low is specifically because of leaky gut and dysbiosis. So that's kind of exciting to make sure that you're treating that and really focusing on that. So this is just another schematic. Also, how methane and hydrogen disulfide induce pro-inflammatory responses. So in SIBO, when you have SIBO and you do the methane test or hydrogen disulfide testing, the breath test, when those are high, that's having a significantly negative impact on our mitochondria specifically and on our pro-inflammatory responses. So a higher proportion of short-chain fatty acids producing bacteria within the intestinal microbiota is associated with a reduction of the risk of obesity, insulin resistance, type 2 diabetes. That's why I use butyrate, especially if butyrate is low. So mitochondria is the target of microbial influence. That's what I want the takeaway. So when you see mitochondriopathies, which is a big thing in medicine now, almost every disease that's studied, and this is what I teach in my courses, that we want to understand the pathology of disease so we know truly how to treat it. And that's why I call it nutritional pathology. What is happening in diseases at the cellular level, and how do we not just treat it but get to the causes of it? And so mitochondriopathies are at the core of almost every modern degenerative disease that we know. So, and some people obviously with polymorphisms can be more susceptible to that, especially ND5s, some cytochrome and P450 and SNPs as well. But that's for another talk. But yes, there are people who are more susceptible to dysbiosis mediated mitochondrial damage or endotoxin mediated mitochondrial damage. And we see the rise of mitochondria in medicine now, and how to really treat the mitochondria as the target of therapies. So we see that oxidative phosphorylation is at the center of this. That's why N-acetylcysteine and glutathione and things that help with oxidative phosphorylation, that's OXPHOS. But we see, all of these, the metabolome, lipid composition or mitochondrial DNA, all of those influence the neuroendocrine, immune, metabolic, cardiovascular, central nervous system, and influence almost every clinical outcome that we can think of. So how do we support the mitochondria is important, and the gut, healing the gut is probably the single greatest influence you can have on your energy and on your mitochondria. So again, another study showing that emerging evidence suggests that the gut microbiota signal to the mitochondria, not only to mucosal cells, but to systemic cells, is one of the greatest factors of how that cell is going to function and what kind of inflammatory cytokines are going to be produced. So this is a short list, but I wanted to give you just a few things. Obviously, CoQ10, quercetin, lipoic acid. I didn't put on here, but acetyl L-carnitine, all of your antioxidant vitamins, and acetylcysteine, all of the glutathione and redox. Another one that's really important is ribose, and I give a big talk on ribose and how ribose as a therapy, especially during leaky gut. So ribose is something in severe leaky gut and in energy pathways. If you're dealing with chronic fatigue syndrome or any kind of gut that's not responding, ribose is a very important and way underutilized nutraceutical and treatment therapy for leaky gut and mitochondrial disorders. So again, if you go to my YouTube channel, I have that, or if you go to my my website as well. Adaptogens are very helpful for mitochondria. Melatonin can be helpful. Obviously, your B vitamins, especially the methyl nutrients if you're low in that. So lots of things that we can do for the mitochondria. The gut, this is a great study, the gut microbiome and its role in obesity. We know how important that is. Some of the dramatic research that came out of a few years ago, where some researchers would do fecal transplants on mice. The key there, one of the most important things there, is that you have to sterilize the gut in order for fecal transplants to work. So if you can do it through nutraceuticals or antibiotics, antimicrobials or antibiotics, but you do have to clean. It's kind of cleaning the shelves in the store in order to make room for new ones. The probiotics really won't colonize. Fecal transplant, don't really take hold unless you're making room for them. But a lot of these studies came out of where they would take an obese mouse and clean, sterilize it, and then take the fecal matter of a lean mouse, and without changing diet, without changing anything, transplant it into the obese mouse, and that obese mouse, even if the diet didn't change, would become lean again. So that's how important that is. So let's get to a case study using the GI360 from doctor's data. So this is the first page that you see, and what you see is kind of a general overview of what the testing shows. Up here in the right over here, you get where you should be. This diagram shows you where you should be in the different classes. And so if you're too small, if you have too less of a number or too great of a number, then it's going to be a factor in the dysbiosis score or dysbiosis index. So you get the key findings here as well. So this patient here actually had irritable bowel disease, and you can see how many classes here are very high and very low. I see the Clostridia class being low. We always think of Clostridia being damaging if it's too high, but that's only Clostridium difficile. A lot of times it's too low, and that's an indicator of leaky gut. It's an indicator of inflammation in the gut. And so we'll go through specifically, but you see blastocystis, dientamoeba, fragilis, occult blood, white blood cells should not be in the stool. That's an indicator of significant inflammation. And it usually goes along with lactoferrin, lysosome, and or calprotectin. Those are all very well correlated with inflammatory bowel diseases, ulcerative colitis and Crohn's and things like that. So what you get is this sample. You get the report of what's high and what's low, and we can go into what each one does. And what I like about the doctor's data report is if there's an imbalance, the end of the report will give you a little snippet of research about what that specific bacteria can be associated with, whether high or low. And you can see down here the Firmicutes and bacilli, and you can look at the ratios there. So a couple of pages of looking at the different Firmicutes, proteobacteria, the major phyla within the human microbiome. You're also it also tests for major viruses, pathogenic bacteria, parasites, protozoa, and again, this person had blastocystis and dientamoeba. Now, what I find is that blastocystis, even the dientamoebas, they're usually a consequence of an imbalance. So usually a consequence of inflammatory, leaky gut and intestinal permeability. So that's what determines whether it becomes a problem or not. And that's why it's controversial of whether you should treat it or not. If you treat the leaky gut, if you treat the underlying pathology, a lot of times those are self-limiting. However, you also want to treat it given your clinical assessment of the patient and how serious that might be. Again, white blood cells should not be in the stool. Also looks for roundworms. It's a very, very, very comprehensive test. And how I explain it to patients when I say I want to do a stool test, this isn't just your ova and parasite test that you get from a local lab. This is looking at how your digestive function is. It's looking at intestinal permeability markers, inflammatory markers. It's looking at your microbiome so that we can know which probiotics actually might be beneficial and which aren't. If there's high lactobacillus, giving someone lactobacillus containing probiotic can actually be harmful. But if bifidobacter is low, for instance, then you want a bifidobacter strain. Look at other pathogenic bacteria, imbalanced Klebsiella pneumoniae. That is definitely one that can be an opportunistic bacteria. If you have leaky gut and you have high Klebsiella or Pseudomonas or those kinds of things, it's going to create potential problems. This patient also had a lot of yeast, both Candida albicans, and two strains of Candida and Rhodotorula. So that needs to be treated. And in my experience, a lot of Crohn's and ulcerative colitis patients have this, yeast and dysbiosis. So that does need to be treated as part of their treatment plan. This is where you get some digestion and absorption markers, elastase here. It's amazing how many people have low elastase, which is a marker of pancreatic function. It's a marker of exocrine pancreatic function, not endocrine. It doesn't have anything to do with insulin, although sometimes exocrine and endocrine function do parallel each other. But we're talking here about, trypsin, chymotrypsin, the things that absolutely need. And elastase, in my opinion, almost everyone with low elastase has some form of dysbiosis because of the altered pH, because of the altered digestion. So, and again, a lot of inflammation, lysosome and lactoferrin. So this patient will benefit from some of the good anti-inflammatories that you can take orally, such as curcumin, such as resveratrol. I find that green tea extract is one of the best things to lower lactoferrin and lysosome within the gut. So I use a lot of green tea extract in my practice. So that's been shown to be very helpful. And again, with occult blood, that's obviously the extreme version of leaky gut. So a leaky gut protocol is extremely important for this patient. And these are the information and reports that you get at the end. One of the other things that's helpful about this test that I didn't show, if there's high yeast and imbalance, doctor's data will run culture and sensitivity to see which botanicals and which nutraceuticals are most, and also pharmaceuticals are most effective. So that's this right here. So with Candida albicans, this one had good susceptibility to several agents, natural agents. So that's a good sign that it's effective. I find that grapefruit seed extract's probably the most widely used in my practice, most widely effective as a general antimicrobial. And it seems to be effective across the board for most microorganisms. So that's one that I use in my dysbiosis protocols quite a bit. So here you can tailor what this patient needs for their specific imbalances. So the Rhodotorula had good susceptibility for a lot of different natural agents, as well as nystatin. So I already talked about melatonin and gut health, so I'll just kind of go through this, give you a chance to look at the studies and see how important it really is. From irritable bowel disease to, like I mentioned earlier, ulcerative or ulcers and SIBO and dysbiosis, really helpful. We know melatonin is a multitasker. It does a lot of different things in the body. It's an antioxidant. It decreases COX-2 expression. It decreases cellular adhesion molecules, so it can help with cardiovascular issues, especially with injury and inflammation within the endothelial system. We know it's an anti-inflammatory in the gut and in the central nervous system, so it's very helpful. And even if when I run the Labrix, whenever I do hormone tests from them, the comprehensive hormone test, more often than not, I just include at least a 1-spot, if not a 3-spot melatonin. I mean, from a clinical perspective, I would say half the people I test have a clinically low, significantly low melatonin. But even if they don't have low melatonin and you're treating leaky gut or treating an infection or treating, some kind of, or even with antibiotics, part of my antibiotic protocol, I use melatonin as a therapeutic agent. We're not trying to, fix or replete any deficiencies. We're using it specifically as a therapeutic agent. So, and one of the reasons why it's so important is because in the gut is because there's 400 times more melatonin in the gut than in the pineal gland. So it stimulates clock genes. It stimulates a lot of those repair genes that are needed in order for the gut and our cells to repair. So, and making melatonin is methylation dependent. That's what I want everyone to know here, that tryptophan to serotonin is methylation dependent. Serotonin to melatonin is methylation dependent. So making sure that somebody has enough SAMe, B12, folate, those things are important. So methylation problems is probably one of the greatest causes of low melatonin. Also pineal gland calcification, herbicides, pesticides, heavy metals, fluoride in the water, those kinds of things. Irritable bowel disease in turn induces a methylation deficit. So be aware of that a lot of people with irritable bowel disease and a lot of people with dysbiosis in turn have an acquired methylation deficit, regardless of their MTHFR status and their genetic SNPs. It's because of the inability to absorb B12, B6, zinc, and magnesium and other trace minerals. So just keep that in mind, that almost everyone I treat with irritable bowel, significant leaky gut, and dysbiosis needs some methylation support. So melatonin reduces bacterial translocation. What do we mean by bacterial translocation? That's a research term basically saying leaky gut, loss of brush border. So those bacteria that even are commensal in the gut will become closer to the cell, the enteric cell, and damage the enteric cell. And those lipopolysaccharides and endotoxins will leak into the systemic blood circulation. So melatonin inhibits alcohol-induced increases in duodenal mucosa permeability. So if you're going to go out drinking, little melatonin can inhibit some of the leaky gut that might be caused by that. Effects of melatonin and tryptophan, this is the one I was talking about. Melatonin and tryptophan is actually more effective at treating H. pylori infection and ulcers than triple antibiotic therapy. So pretty amazing that we've got some good research on that. Pancreatic insufficiency, we already talked about this. Bloating after meals, abdominal discomfort, flatulence. Again, a lot of the signs and symptoms of SIBO. And in my experience, almost always SIBO has a pancreatic and hydrochloric acid component. Causes are can be many: insulin resistance, smoking, Crohn's. I mean, what damages the pancreas is oxidative stress ultimately. And so lower glutathione status, a leaky gut will damage the pancreas. So other potential laboratory and diagnostic tests that clue you into pancreatic insufficiency: low serum albumin, serum amylase elevated, pancreatic elastase, like we talked about, or chymotrypsin. You can also do chymotrypsin stool or serum. You can get pancreatic calcification, maybe ultrasound, but those are some things that you want to see. This was also another, the CSA by Doctors Data, their other stool test, which I've pretty much switched just to, at this point, just to the GI360. So the pancreatic insufficiency treatment, at first, you want to supplement with some digestive enzymes, specifically trypsin, chymotrypsin, pancreatin, hydrochloric acid, bromelain, papain. But glutamine and acetylcysteine ultimately are what's going to repair the pancreatic cells. So remember, food is your medicine. I've always liked this study because what we eat that we think is normal, that we think is good for us, has severely detrimental effects. But a lot of farm-raised salmon, farm-raised fish are a big inducer of leaky gut. So acute inflammation was characterized. So the fish developed significant leaky gut and increase of cytokines because they're fed, corn gluten and sunflower and all kinds of stuff they're not meant to eat. So, and then that's what we eat. And it's the same with cows, commercial cows. There's some studies showing high zonulin in those commercial farmed, confined animal feedlot type of meats, and high zonulin will then induce leaky gut. So a steak is not a steak, an egg is not an egg. We know this, but it's important to be able to tell this to our patients in a way that's clear and will affect change for them. So if you're not inspired, I hope, this gives you just a little bit of inspiration to live healthier in every way possible. And it starts with the gut. It starts with diet. It's so important to make sure that we do everything we can. Remember that three-legged stool: diet, lifestyle, that again, melatonin and sleep, and exercise and supplementation. So again, all of the protocols that I have, you can email me. So you can go to drbrandonlundell.com. You can email me, hhc@drbrandonlundell. I'll get to some questions here in a minute, but this is my functional medicine and nutritional pathology series. It's 6 modules. You take a test at the end to get certified. Each module is 12 to 15 hours. I take all the training that I've had over 20 years, and I put it into a easy to understand, easy to follow, the most essential information that you're going to have. And the most important thing that differentiates, I believe, my classes from a lot of other functional medicine classes out there is I teach you how to think critically. I often say a good doctor knows what to do, but a great doctor knows why. I can teach you what to do. You can go to a class and learn what to do and memorize protocols, but to teach you how to understand why these work, what the causes are, why something happens, then that's what makes you a great doctor. So here you can, I go into a lot of different topics in each module. Module 3 is my functional gastroenterology, and I take a deep dive into all of this and more. Module 4 and 5 are endocrinology, detoxification. That's where I talk about preconception planning. And so you can take each module by itself, or you can do the entire course at a great discount. So if you buy the entire course, I discount it to $29.50, and you can actually email me. I'll give everyone till next Wednesday at noon Mountain Time. If you want to buy the course, I'll give you another $500 off. If you email me at HHC at Dr. Brandon Lundell. I'll give you a $500 off coupon. And just mention that you were at the Doctor's Data seminar today. So I also do functional medicine consulting and mentoring. So that's at the bottom of the nutritional pathology course page. So thanks everybody. I hope I gave some food for thought, pun intended, about the GI and new therapies that you can think about for your patients.